Everyone, here I'm back with another video lecture, and today we are going to discuss about the Boutonniere deformity. Boutonniere deformity is basically a common injury to central slip extensor tendon. Basically, this is also known as buttonhole deformity because of its appearance. Start from the very basic knowledge about the central split tendon rupture. Basically, start if we are going to see this picture, or you can say that the picture that describes the basic finger. Start from the very first joint, that is MCP joint, then next one is the PIP joint, and the last one is the DIP joint. Near to the PIP joint, the central slip, or you can say the extensor tendon, is basically ruptured on from the posterior or from the back side of the hand, and that can cause basically the PIP joint flexion and DIP joint extension. Now start from the basic mechanism. What is the basic mechanism of the injury that is involved in this, you can say, the condition. Mechanism is basically PIP joint forcefully flexed while actively extended. During the sports, when your hand is fully extended or your fingers are fully extended, sudden impact or sudden force that can you can say that can attack, or you can say that can cause sudden impact from the back side of your hand on the area near to the PIP joint, that can causes a forceful flexion while they have already actively extended. That can cause basically the central slip extensor tendon rupture or tear of the central slip. Now that can causes a PIP joint flexion and DIP joint extension. This is basically common in basketball players because of the basic you can say the protocol, you can say the basic process, or you can say the basic steps in the basketball, or you can say the during the passing of the basketball, or you can say that during the dribbling of the basketball. These are all the basic conditions in which you can say the Boutonniere deformity has to be occur. Okay, volar dislocation are always, or you can say a most commonly associated condition that is associated with Boutonniere deformity is volar dislocation of PIP joint, can also cause central slip tendon rupture. Sometimes there is volar dislocation of PIP joint is always causes the central slip tendon rupture or anterior dislocation of the PIP joint. The basic sign and symptoms of the condition is pain and localized swelling on the PIP joint and tenderness dorsally of the middle finger. Basically, this can tells us about the basic intro that the middle finger is the most common finger that is involved during this condition. Diagnostic test is basically simply you can hold a joint in a position of 15 to 30 degree of flexion. Positive sign shows the patient is unable to actively extend the joint, and passively extension may be possible. Okay, simply you can say that when you perform the position of 15 to 30 degree of flexion, patient is unable to actively extend when you instruct the patient. But when you can perform itself, or you can perform, a therapist can perform this position, so they can easily perform, because the muscle work does not need any and it's on, or you can say it's on contraction. You can simply a therapist can perform, so you does not have to work on that. Okay. Okay, next one is the management. Simply, a management has three main points: splinting, active assisted, PIP, or you can say start from the passive, then active assisted, and then resisted. So splinting is basically a full extension of healing, full extension during the healing process. For the first 6 weeks of healing, in case where no erosion has taken place. Okay, start from the very first. Why we need a full extension for the first 6 weeks of healing? That means in acute stage. In case where no avulsion has been takes place, basically the avulsion means the avulsion fracture. And the third one is the avulsion involves less than 1/3 of the joint. Okay, basically if the avulsion has been occurred, so you cannot basically stop the avulsion, right? So you can simply say that is less than 1/3 of the joint that is involved in the avulsion. So you can basically splint the area, or you can basically splint the finger in a full extension position. Next one is active assisted PIP joint. Before that, you can during the splinting phase, you can simply perform the passive exercises or passive extension exercises. But after that, you can after the splint has been removed, or you can say the after the splint has to be near to be removed, you can perform the active assisted PIP joint extension and maximal active force flexion of the DIP joint. This is basically the simple management during the physical therapy treatment, because this condition is not only associated with sports but mainly that is also associated with the rheumatoid arthritis. Rheumatoid arthritis is basically simply a condition that is an autoimmune condition. Basically that involves the gene HLA. So you can say that if the condition that is related to the autoimmune process or inflammatory process, you cannot do too much of the things in a physical therapy. You need a medical intervention. So after that, you can say that before the injury, or you can say the injury prevention mechanism during the athletes or during the sports, mean that we have say that the basketball that is taping and splinting during the sports. That means simply when the person can play during the, or you can say the athlete or that sports person can play during the, or participants can play during a basketball game, so or basketball tournament. So you can simply prevent that these areas by taping or splinting. Now the main point is all splints treat PIP joint except stack splint that treat DIP joint injuries. DIP injuries are basically mainly treated by stack splint, but all splints are used for PIP injuries. That is basically a simple splint information. Complication in healing, basically during the process, basically the main complication is avulsion fracture, and that needs a basic medical intervention. So you have to refer the patient to the medical specialist, or you can say the physician, or you can say the main orthopedic, to prevent the future complications. Boutonniere deformity develops over the period of weeks and also occur acutely. So they can say simple in a simple form that Boutonniere deformity can develop over the period of time, weeks, months, or you can say the basic main condition that is occur over the period of weeks is Boutonniere deformity, and that is basically occur during the you can say the progressive So you can say if the condition is developed over a period of weeks, that mostly involves during the process or progressive inflammation in a rheumatoid arthritis, and if the condition is performed, or you can say if the complication occur during acute phase, that is basically in sports. So you can say this is the whole or you can say a brief introduction regarding the boutonniere deformity. Basically a common injury to the central slip extensor tendon, also known as buttonhole deformity. Mechanism is basically PIP joint, or you can say the proximal interphalangeal joint, that is forcefully flexed while actively extended. Common in basketball players. Volar dislocation of PIP joint can also cause central slip tendon rupture. Sign and symptoms: pain and localized swelling. Diagnostic test: basically a positive when patient unable to actively extend and passive extension is possible. Management: splinting, active assisted PIP joint extension, maximal active force flexion of PIP joint. Complication and healings is basically avulsion fracture is the main that needs a medical intervention urgent. Thanks for watching. If you don't understand anything, you can ask in a comment section, or you can go to Facebook or Instagram page. Thanks for watching.